we have a lot of questions ourselves. We're getting a lot of phone calls at even at City Hall, in case you wondered where some of those calls are going. For some reason, they also come here. People have a lot of questions about the vaccination locations, schedule, and that kind of thing. And we really don't have that information. So I guess one of the purposes of today's call is to provide more information, practical information people can use in terms of the vaccination, because that certainly is a number one issue out there. Just make a prefatory comment that the city's been continuing to be extremely energetic on the part of our police department, fire department, permitting in terms of enforcement of compliance with our mask ordinance, and also in keeping an eye on gatherings and special events. We seem to, even after New Year's Eve activities, which were kind of rather infamous, if you will, we continue to see a number of too many special events being scheduled in the next few weeks. And we really appreciate the public's health in providing tips and notification about these events. And we are paying visits and following up with people to find out, what the real story is. Is it a big event or actually a smaller event? And in most cases, people are respecting that and complying after that. We have actually, I checked the other day, we've made 300 compliance checks just since December. That's a lot of compliance checks with businesses and, again, special events and such. And these are all based on people who call us and say they're concerned about something happening at a small business or a restaurant out there. And again, when people are reminded about what the rules are, and I'm really talking about the state rules, the orders of the governor of South Carolina, once they're reminded about the governor's order, they do comply, and we have good cooperation. But we do have to be vigilant to do that. And we made 300 site visits since December. So we're out there trying to keep our ear to the ground and eyes open, and appreciate the public's health on that, because it's extremely important, especially in light of the vaccine coming. With the vaccine coming up, and again, I hope that's a major part of what we're going to hear about today. In between that time, people would be even more mindful about avoiding crowds and wearing masks indoors, which is the requirement in the city. And with so many businesses, that's not too much to ask. It's our effort to help Prisma Health, to help our healthcare professionals, our doctors and nurses, help them do their job by doing our job, if you will. So we're trying to continue to get the word out, continue to be out there and enforcing compliance and sending those messages. And we look forward to hearing more about the real news, which is the vaccination program. We look forward to partnering in any way with Prisma Health also in terms of making that program as effective as possible.
And we'll go to Mr. O'Hala.
Thanks, Knox. I'm so used to you leading the charge on these things. Thank you very much. We've continued to see a significant surge since the holidays, particularly Christmas and New Year's holiday. What's been happening not only across the Prisma footprint, but literally across the state. We've been seeing new highs in pretty much every category. We've been running over 30% positivity rates for the month of January. We have set new records as of yesterday, over 2,400 hospitalized COVID patients across the state, which is a new record for the surge. We've also seen that those over 2,400 patients account for nearly 30% of all hospitalized patients across the state of any stripe, and that's also a new record. Greenville particularly has been at the heart of that surge. On Monday, we saw a nearly 40% positivity rate across the Greenville community. This is off the charts high, 40%. Considering that our goal is to try to get that to 5% or less. Greenville had the most infections of any mid-sized city in the nation this past week. And again, we are just asking everybody to please follow the guidelines and help us turn that curve down. This week, we had over the month of January, Prisma has been dealing with over 570 patients per day. To put that into some context, last surge in June and July, the highest number that we saw across the system was 320. So it's an exponential surge in the number of people that we have to care for, nearly 78%. And obviously that is putting a lot of constraints on all of our resources and stretching our staff incredibly thin. Fortunately, because of Prisma's size and footprint across the state, we've been able to manage the new surge by moving patients appropriately from one facility that may not have any beds to another facility that does have bed capacity. It's a process that we go through literally day in and day out, hour in and an hour out, minute to minute, to make sure that we're getting the care to the patients in the best way possible. Because of the surge, we have on occasion made decisions to postpone non-elective or non-emergent cases in order to make sure that we have enough resources to be able to handle the COVID surge. On a staffing front, we have over 350 of our Prisma team members who are out with COVID. And out of that number, about 180 of them are clinical, registered nurses, physicians, and other clinicians. Obviously, this is making it challenging for us to make sure that we have all of the right staffing in the right places. But we have been able to navigate through that and manage through that by bringing in agency staff and what we refer to as travelers, people who are outside of the area and not permanently on our payroll, that we bring in to augment all of the care that we provide. We have been working extremely close with the South Carolina Department of Health and Environmental Control, South Carolina National Guard, and South Carolina Division of Emergency Management to partner through all of these challenges across the system. I do want to say thank you very, very much to Greenville County for its funding of 3 new mobile vans that we are going to be rolling out to help us with our vaccination efforts. These 3 vans, these 3 mobile units, will have one delivered at the end of January. We'll have 2 more delivered at the end of the first week in February. And the county graciously allocated a portion of their CARES public health, community health grant that allowed us to make these purchases. And we really, really appreciate it. It's desperately needed resources. I just wanted to thank the county for helping us with that. On January 18th, we are opening up a COVID step-down unit in our Prisma Lawrence facility so that we can shift patients who they're still sick and they're not quite ready to go home, but they have passed through the acute phase of the illness and no longer need to be on an acute care floor. It'll allow us to move those lower acuity patients into new unit, incremental bed volume. So it'll free up ICU beds and other medical surgical beds in our existing facilities that we need to continue to take care of the new COVID patients who are arriving at our facilities. Obviously, all of this is going to be helped dramatically by the new vaccines that we are now in the process of rolling out all across the state. Couple of key issues. We are letting everyone know the vaccines are completely safe and very effective. And there's been a lot of stories written all across the country about people across the country who are worried about taking the vaccine or not really sure if they think it's going to be helpful or not. We want everyone to know it is very effective, it is very safe, and we want everyone to sign up to get vaccinated. We received our first shipment of vaccine, and we received the Pfizer vaccine on December 15th. We began vaccinating our team members the same day. Originally, we began at 2 locations, Greenville Memorial and Richland in Columbia. We have now expanded across the entire platform of Prisma So all 12 of our community hospitals across the state are vaccinating people, and we're going to continue to expand beyond those hospitals. We'll utilize, in Greenville County, we'll utilize the mobile vans to help us get outside of the hospitals up here. And across the rest of the state, we're also going to be looking at expanding locations outside of our hospitals in order to make it easier for people to get vaccinated. We are currently vaccinating everyone that has been designated in the Category 1A, and we've had very good success with getting those people into the pipeline. We had a big surge of signups late last week and into the beginning of this week, and we're very pleased with the progress that we're making on that front. We are now also continuing to see a significant number of the total vaccines that are being delivered across the state are being delivered through Prisma Health. As of yesterday, we had administered over 22,000 doses across the state, and we are averaging over 2,000 vaccinations per day. We're continuing to ramp up capacity, and Dr. Sakosha will be talking about that in just a moment. In total, we have vaccinated, as of yesterday, 18% of all of the people in the state of South Carolina that have received the vaccine, which is the highest number of any of the health systems in the state. I want to make sure that everyone understands the logistics of the program that we're addressing. We have been receiving, and let me be more specific, the state of South Carolina has been receiving approximately 64,000 doses of vaccine each week. Those doses are then distributed out across the state by DHEC, and as soon as we get them, we go about delivering them. To put this into some perspective, there are approximately 5 million people in the state of South Carolina. If every single person decides to take the vaccine, we will need a total of 10 million doses in order to vaccinate everyone with both shots. Now, the governor and DHEC, the South Carolina Hospital Association, everyone has been working very closely to make sure that we are doing everything that we can to vaccinate as many people as we can, as fast as we can. And with the flexibility that the governor gave us earlier this week to begin pulling people 70 years of age and older into the queue, we're in the process of ramping up, gathering all of that information so that we can start putting people into appointments. The thing that I need everybody to understand is we need everyone to be patient. The limiting factor right now today is the number of doses that we receive. And so we can expand capacity. We have expanded capacity. So can every other healthcare provider. So can DHEC. But at the end of the day, if we don't get larger quantities of vaccine into the state, having the additional capacity is not going to help us speed up vaccinating or vaccinating more people. So we're very much constrained by the manufacturer's ability to get more doses distributed out across the country. And with that, I'm going to hand this press conference over to Dr. Sariya Sakosha. Sariya has been leading our vaccination team across Prisma. Sariya?
Yes, thank you. And as we heard just a moment ago from Mr. Ohala, we have vaccinated over 22,000 vaccines into the arms of individuals across the community. Approximately 50% of our own team members, healthcare workers, have been vaccinated in this lot. And thus far, we have had only 3 moderate reactions of those 22,000 and 0 severe reactions. In addition, Governor McMaster opened the vaccine to all non-COVID hospitalized patients 65 and older, and individuals who are 70 and older in the community. Tuesday, we heard President Trump expand phase 1B to those 65 and older. And as Mr. Ohala stated, we're expanding our vaccinations and we've doubled the number we're already giving, but we limited by the amount of vaccines we receive. This will continue to remain a challenge as we continue to increase capacity through our current sites and adding additional. We'll continue to seek approval from DHEC for additional vaccine doses. We're accepting patient information for those over 65 and older in the community, and we'll continue to follow DHEC guidelines and recommendations from the governor for who is indeed included in phase 1B at this time. The individuals that contact us can fill out an online form on our website. That's www.prismahealth.org/vaccine, www.prismahealth.org/vaccine, or they can call 833-2-PRISMA to put on the waiting list their name as we enroll them quickly through the process. That's 833, the number 2, PRISMA. We'll follow back up to schedule these groups of individuals as we continue to receive additional vaccine supply. Sign up for an appointment. Don't just show up. We want to be able to give you the vaccine whenever you present. When authorized by state officials, we'll begin to vaccinate the rest of phase 1B. That includes essential workers such as teachers, those working in public infrastructure, such as sanitation, the post office, manufacturing, and many others. In collaboration with DHEC, we'll continue to expand our vaccine sites and resources as vaccine doses increase. Please know that we are working very hard on all the details in an environment that is changing by the minute. All of our vaccine updates and frequently asked questions can be found on the Prisma Health website. Please, at this time, do not call individual physician practices or Prisma Health pharmacies or hospitals about the vaccine, as this information is available on our website and through the 833-2-PRISMA phone line. We're asking the public for patience. However, we are very, very pleased with so much interest and excitement about receiving the COVID-19 vaccination. This is exactly what we need in the state of South Carolina, the interest and energy to be vaccinated against this deadly virus. While you're waiting for your appointment, here's what you can do to help. Remember that even after you receive that first dose, you still need that second dose to achieve 95% efficacy. This means you still have a risk of becoming infected, particularly due to the high infection rate across the state of South Carolina. And the vaccine will not be widely administered to 75% of the population until this summer. So please, please continue to maintain 6 feet social distance between yourself and others. Wear a mask in public and when you're around others. Wash your hands frequently. Avoid group gatherings and stay home. Please stay home if you are sick and experiencing symptoms. Thank you so much. We are all in this together, and together we will get through this.